Hello everyone. Today I'm going to talk a bit about diabetes, also called as diabetes mellitus. So what is diabetes? Diabetes refers to persistently elevated sugar levels to the tune of greater than fasting sugars greater than 126 milligrams per deciliter, and after eating 2 hours after eating anything or drinking anything except water to the tune of greater than 200 mg per deciliter, or the HbA1c levels greater than 7%. The normal levels are 5.5 to 6. The levels of HbA1c, the normal levels are 5.5 to 6%. So, what are the types of diabetes? Diabetes are basically categorized into type 1 diabetes, or the childhood diabetes, type 2 diabetes mellitus, also called as adult diabetes, and then the gestational diabetes, which may happen to some females during pregnancy, which is of course reversible as the pregnancy is terminated, or pregnancy after the birth of the child, after delivery. So when does type 1 diabetes happen? Type 1 diabetes usually is diagnosed at about 20 years of age, and genetics play an important role in that. It plays an important role in the pathophysiology of type 1 diabetes. Type 2 diabetes, or the adult onset diabetes mellitus, basically it comprises about 80 to 95% of all the diabetic patients, and there are several factors leading to diabetes mellitus type 2. First of all, genetics itself is responsible for type 2 diabetes mellitus. Just like type 1 diabetes mellitus, type 2 diabetes mellitus may also be caused by some genes which are transmitted or inherited from the first degree relatives. Then second, very much most important, is obesity. Body mass index greater than 30 is a very leading cause of diabetes and in the present population. Apart from this, taking too much sweetened drinks, then lack of exercise or physical activity, all these are factors which may lead to type 2 diabetes mellitus. Now, what a person may experience, or what are the signs and symptoms of diabetes? Diabetes mellitus is roughly, you can sum up it in a phrase of polydipsia, polyphagia, and polyuria. So polyphagia is an urge to eat too much. You get hungry frequently. You have an urge to eat repeatedly. Then polydipsia, you have an urge to drink repeatedly. You feel thirsty and have a tendency to drink more than the usual frequency. And then is polyuria. Polyuria is frequent urination. That is, there is increase in the frequency of urination. You repeatedly feel an urge to urinate. And then, of course, there is weight loss. So, what can one do if one at all gets diabetes mellitus? So, categorizing the treatment of diabetes, taking into account its types. Type 1 diabetes mellitus, or the childhood diabetes mellitus, insulin is the mainstay of treatment. It is not treated by oral hypoglycemics or the oral medications. As far as type 2 diabetes mellitus, which is more prevalent in the society, it can be treated either with the oral hypoglycemics or the oral medications, or insulin at a later stage. Then weight reduction or controlling obesity is yet the modality to control type 2 diabetes mellitus. You can control your weight, or just in case there is excessive obesity, even if one goes for bariatric surgery, after the weight reduction, the sugars are normally controlled with little or no medications. Eating or consuming a diet rich in polyunsaturated fatty acids such as sunflower oil, coconut oil, and reducing your intake of saturated fatty acids usually leads to controlled sugars. Also, you have one needs to take cut down on protein, one needs to cut down on fats as well as carbohydrates in his diet, and have a more inclination towards protein rich diet. Then of course exercise and physical activity plays a role in the control of diabetes mellitus or sugars. So now coming to the complications which a person may get after 10 to 15 years of diabetes mellitus. Usually they come after 10 to 15 years of diabetes mellitus, but if the sugars are controlled and during this 10 years period or the 15 years period, if they are kept under good control, the complications onset may be delayed. But usually they come, only you can delay the onset of these complications. So the various complications of diabetes mellitus which a person can encounter later in life are atherosclerotic diseases of the heart, that is the coronary artery diseases. Then second is the kidney disease, or the kidneys may fail at a later stage. Then neuropathy, diabetic neuropathy, a person experience numbness of the feet or neuropathic pain in the feet. And if there is numbness in the feet, a person may not feel any wound, so a slight trauma may cause a wound without a person realizing it, and it may get infected, and it may be a cause of amputation because of the infected diabetic foot. Then there is diabetic retinopathy. A person after 10 years of diabetes must get his eyes checked once a year from ophthalmologist, since there is a tendency to develop diabetic retinopathy. Apart from this, diabetes is a syndrome. Itself is a syndrome and is a combination of several entities, and it's a combination of too many factors, and at a later stage it may involve many organs of the body. So better to take care of your diabetes, and that is all in today's video. Thank you.